Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. South Korea is continuing to experience one of the biggest surges in Omicron cases anywhere in the world. That being said, as we just heard from our reporter earlier, there was a dip, or is expected to be a dip, on Monday. And South Korea's New Delhi infections on Sunday were well below 400,000 for the fourth consecutive day. But unfortunately, the numbers still rather depressingly high. The number of critically ill also at around 1,200. This is putting extra pressure on an already strained healthcare system.
Experts say the country experienced the peak last week when the daily count spiked to over 620,000. But there are still fears of another spike due to BA.2, a subvariant of Omicron. For more on where South Korea stands in terms of COVID-19, we connected Dr. Alice Tan, internist at MizMedi Women's Hospital. Good morning, Dr. Tan.
Good morning.
So let's start with the subvariant. It's generally accepted that people who've recovered from the first strain of Omicron have built up natural immunity. But can they still catch BA.2? And can we expect similar symptoms with the initial strain?
Right, the symptoms of BA.2 do seem to mirror those of BA.1. Very severe sore throat, headache, fever, chills, muscle aches, some gastrointestinal symptoms in terms of nausea, vomiting, and diarrhea. Some reports have been made about dizziness, but we're not sure if that's secondary to dehydration because of vomiting and diarrhea, or if there's a primary problem going on either in the vestibular center of the ear or the brain. In terms of protection, there was a study from Qatar that showed that prior infection with BA.1 offered 95% protection against infection with BA.2. However, the reverse, so infection with BA.2 seemed to only offer 85% protection against BA.1. So in terms of reinfection risk, it is possible, but the risk is much lower for the two Omicron variants.
Okay, that's good to hear. I had Omicron last week. Hopefully I got BA.1 rather than BA.2. The big news related to vaccines this week is from Thursday. Children will be permitted, providing they get parental consent, of course, between the ages of 5 and 11 to get a shot against COVID-19. As we heard from our reporter, there are a great many parents in South Korea who are really skeptical about giving their young children this COVID-19 vaccine, considering that a lot of kids have already had COVID-19 and they generally recover much quicker, and there's very rarely that they ever go to hospital or anything like that. So do you see many parents taking their kids to get vaccinated? And there's also the concern in so much as that we know the short-term risks aren't particularly that large with the vaccine, but there are some things we definitely don't know at this point in terms of the really long-term effects, possibly, of these vaccines.
Right, so the hospital where I'm at, we're going to be starting vaccination in children between 5 and 11 in a few days. So I haven't seen the rush to get children vaccinated. I understand that there is a lot of hesitancy among parents of children in this age group, but let's just break down what we're talking about in terms of the safety, the efficacy, effectiveness, and what we're dealing with in terms of risk. In terms of the safety, there was a report by the US CDC after 8.7 million doses of the COVID-19 vaccine by Pfizer was administered in children between age 5 and 11. And what they found is that this vaccine is very safe. There were 3 reports of death among the 8.7 million doses delivered. 1 child had influenza at the time of death, and 2 children had very complicated medical conditions that were underlying their health conditions. Also, in terms of efficacy, we know from the phase 2-3 trials that the vaccine is 90.7% efficacious in terms of preventing symptomatic COVID disease. And then in terms of real life effectiveness, the vaccine was found to prevent hospitalization in this age group by 74%. So it's very efficacious and effective. And in terms of the risk, what we're dealing with here in Korea, we need to realize that up until Omicron, there were 3 deaths in the pediatric population. Since the onset of Omicron, that number has nearly quadrupled, and 11 children have died. In terms of who is dying in that pediatric population, 9 out of the 11 deaths occurred in children aged 9 and younger, so unvaccinated children. And in terms of severe complications, we know right now there are 20 children in ICUs. That's more than any number that we've seen up until this time. And there have been also 16 cases of multi-system inflammatory syndrome in children in ages 12 and below in Korea. This is a potentially fatal condition, very serious. And so we know as Omicron keeps on spreading among children that there will be more cases, more hospitalizations, perhaps more cases of MIS-C, and unfortunately, there may be more deaths as well. And we want to be able to protect our children. Any number of deaths in children is too many. And I think that's the reason why the US CDC, the American Academy of Pediatrics, the government of France, many countries around the world are encouraging parents to get their children who are aged between 5 and 11 vaccinated against COVID-19.
Right, Dr. Tan, also, considering that there are some 2 million people being treated at home due to COVID-19, and many of them are possibly fully vaccinated, how much do you think that there will be hesitancy among some people to get their booster shots because of this?
Well, we have to understand what's going on. Basically, there's waning of immunity. After 3 to 4 months of the second dose, the protection level goes down. And because Omicron is so good at evading both vaccine-induced and natural infection-induced immunity, we really need that third dose. We need that booster to get our protection levels back up. And most of the people that I know who've had breakthrough infections, they go through the infection, they feel the symptoms, they have fever, muscle aches, cough, the worst headache of their life, a burning sore throat, and they tell me they are so glad that they got vaccinated because they are really aware that it could have been much worse. Once they feel just how strong COVID-19 can be, even with having had 2 vaccines in their system, they are very thankful that they got vaccinated. They regret that they were not boosted. And that's the opinion that I've heard from many adults. And so that third dose should not be considered as an option. It really is necessary to get our immune levels up to where they need to be against Omicron.
Okay, really quickly, because unfortunately we are running out of time, but I have to ask you this because we're going to be into our 3rd summer shortly of wearing face masks outside here in Korea. Many countries have scrapped them. In just 30 seconds or so, when do you think it's going to be sensible for South Korea to say, look, it's just an individual choice whether you wear masks outside? I'm not talking about inside here.
Right. Well, summer is 2-3 months away. If we don't have a new variant, I think we will be able to bring our transmission levels low enough and have our hospitalization rates low enough, enough space in our hospitals to deal with the load of new cases, that we may be able to take our masks off outdoors. But we have to remember in the Seoul metropolitan area, it is such a highly population dense area. Sometimes it's very hard to keep a safe distance from strangers. And so hopefully we'll be able to have a maskless summer outdoors this year, but we will have to see.
Well, let's hope for that. Dr. Tan, thank you so much for your insights. We appreciate it.
Thank you.